All right. How are you? Okay, I believe we're doing fine. Today we'll be talking on difference between normal discharge and infected discharge so that you know your state. There are so many discharges that every woman sees depending on the state of her system. All right, vaginal discharge can be a natural and normal part of a woman's reproductive system. All right, but then it can also be a sign of infection most times. Okay, so here we are going to break down on how the difference is actually being identified on normal vaginal mucus and that of vaginal infected discharge. Okay, how the normal discharge has its own consistency. You can actually clear yourself by knowing that normal discharge of every woman, the normal mucus in the vagina of every woman, has clear and cloudy state, and that clear and cloudy state is normal, and then that cloudy in color is equally normal. Then thin and slippery is another way you can actually identify that mucus coming out from your vagina is normal. Most of the times people have these people actually misunderstand it. Once you're having discharge in your vagina, you start running to the hospital, you start complaining and the rest of it. Today, know that certain slippery nature that you're seeing in your vagina doesn't really mean that you are having infection. It is tiny, and then that slippery nature on it is actually similar to that of ovulation, but then it's not really the ovulation. Do you understand? It's still normal. Other consistency can actually be seen. That consistency is the concentration of that mucus at that particular time. Do you understand? It still indicates once the concentration of this very vaginal mucus is, that consistency differs just in line with the concentration of in every cycle of every woman during the period of her menstrual cycle. The consistency differs. Do you understand? Again, this same mucus you're talking about, the normal mucus we're talking, vaginal mucus we're talking about, you find out that that particular neutral one that is normal is odorless. And then when we talk about the odorless, it indicates that it has a very it doesn't have any strong smell, it doesn't have any foul smell like fish-like and the rest of it. Do you get it? The consistency is always there, showing you that this is normal. No itching attached to it, no fluid consistency flowing out, but you actually know that something is coming out, but not as if it's flowing like that of the person that has infection. Now we have to actually take it to that vaginal discharge, that infected vaginal discharge. How do you know? It's thick and the cottage, and it has this cheesy like smell, and at the same time consistency. Do you understand? Vaginal infection discharge can be thick and clumpy and resembling that cottage Chinese. Do you get the smell? And as well, okay, another way you can actually identify that if your vaginal mucus is infected is the deep yellow, green and gray color that you can actually see flowing as if that person is actually menstruating, and the menstruation is actually coming in scanty way. You see, consistently when you open your pants, you find out that you have those smells attached to it. So that indication can actually be as a result of kind of infection that somebody has at that particular time. You can actually see a gray color, see deep yellow, you can actually see green. Do you get? Depending on what you're seeing, even people go ahead to see black color, dark brown, not as if that person is having some bleeding. Do you understand? Do you understand? But then once you're having those indications, you're having those colorations, you just know that you are having some infection. What you needed to do is to run to the lab and indicate yourself, be able to tell the scientists around or the doctor around that you are having this discharge, and the infection test, complete infection test, has been run on you. All right, we'll go with the strong and unpleasant odor. You know, the vagina discharge is not actually meant to be, it's odorless, it's not actually meant to have any odor. It's supposed to be like that, natural, the way it is, not strong, just mild like that. But then vaginal infection discharge often has the strong and unpleasant smell, which if you're having it, some has a stockfish smell, some have sardine smell. When you're having this, depending on the kind of infection you're having presently, it has its own smell. So once you're having this, you run. Then another indication is having an increased amount of this same discharge, maybe as a result, or so significant enough that it may actually accompany maybe blood stain or itching or burning or redness in that same vagina or that very region. Or when you urinate, you feel some harshness there, you still feel some hot sensation in that very vagina part. That indicates, mind you, some people don't actually feel those they don't actually feel that hot flash or feel that hot sensation, do you understand, in their vagina. It's just flowing like that, like you're having some fluid retention, or you're having your menstrual remnants flowing out at that particular time. Once you actually see yourself with an increased amount of vaginal discharge, whether you're having issue itching or not, so far there is foul smell, need order, the discharge is above normal, run to the lab and clear yourself. This could actually be the cause of infertility surrounding that unhealthy state of conception. All right, we'll talk about the abnormal consistency. The consistency of this particular vagina may actually be different from the normal because the mucus there is actually thicker and more watery. It's actually thickening in concentration most times, or more watery at a particular time. So type of all those vaginal discharge could actually be an issue. So you have to work on yourself. Check the difference between your normal discharge, even when you've treated yourself, and the present discharge that you're having. Most times you have, when you have intercourse, you find out that intercourse you're actually having, there's discharge, there's release of sperm cells into your system, and once it's released, because women are reservoirs, the man who you're actually sleeping with pours in his semen during ejaculation into your system. Few days after, you find out that you're having heavy discharge, and once you're having that, it's an indication that you're having infection. And I would advise, whenever you're treating yourself, let your partner equally go straight to the hospital or the lab and be able to diagnose himself. Most times men will say that they're not having issues. So know that the difference between the normal discharge and that of infected discharge is so obvious, and be able to help yourself. Now, among this type of discharge, there are so many there. Which types of vaginal infection can actually equally indicate? When you're having yeast cells overgrowth, there are certain, and fungus or yeast concerned infection. There are other infections. There are so many fluids that you can actually see. There are some that are sandy and thick. Those discharge and itching associated to it indicates that you're having yeast infection. Bacterial vaginosis can actually accompany itself with imbalances of the bacteria in the vagina, thereby bringing bacterial vaginosis into our system, bringing discharge of grayish color and discharge and strong odor that will actually be discomforting you. Another one is trichomonas infection. When you're having infections with trichomoniasis, you find out that you're having some parasites surrounding there, and then it can actually be greenish or greenish yellow in color. And when you're having that, there is itching associated to it. It could be deep inside the vagina. It could be, you'll actually be feeling it. That's why many women put hands into their vagina. You see this nails, it has a lot of deposition of bacteria in it, and once you're actually inserting it into your vagina, it's actually depositing some bacteria there, and then the normal flora in the system mix up with it and then cause some problems to us. Okay, so when you're having all this, I've talked about the yeast cells accompanying the discharge. We've talked about bacterial vaginosis. We've talked about trichomonas vaginalis. We've talked about so many things, and we've talked about that very discharge that is so heavy and sticky, and the one that is so that the odor is so strong. Even the one associated with the sperm release into your vagina, in a few days you start having fluid. Just know that your partner equally needs an attention. Do well to differentiate between normal vagina and that of infected vagina. In so doing, it to keep the acidity of your vagina so in check. Thank you, and don't forget to subscribe. We'll continue to make you take in charge of your health.